Hey there, I'm Dr. Jill Wener. I am a board certified internist. I am a certified conscious health meditation instructor and tapping practitioner. And I am an expert in physician wellness. And I have retreats that I do across the country for women physicians and women in healthcare. And I'm a co-founder of the Transform Mastery Retreat for women physicians. And I am now doing these every day on weekdays. I'll be doing these tapping support sessions to help people, including healthcare professionals or anybody actually, who is struggling with some of the difficulties of this pandemic. I know lots of healthcare professionals have been suffering from fear, anxiety, some resentment, some anger, lots of different emotions coming out for people who are actually on the front lines taking care of people. And then there's also lots of emotions for people who are just living their everyday life and trying to process all the information and figure out how to keep themselves safe, how to keep their families safe, and still make a living for themselves. There's a lot going on right now. So I'll be doing these sessions every weekday at noon Eastern Standard Time. And I will be posting the replay on my YouTube channel. Hi, Carrie. I'll be posting the replay on my YouTube channel so that anybody can watch these after the fact. So I'm going to just start a little bit about what tapping is and what I'll be doing in these sessions. And then for the following sessions, you can just join right in. So also, I need you to know I am a physician, but this is not medical advice. I'm not going to be answering people's questions about the actual virus itself or how to handle it. We're going to be talking about emotions here and dealing with stress, how to cope with this, but I'm not giving medical advice. There's lots of places you can get that, CDC website. I've been checking out the New York Times for some really great updates from them. I look once a day on that. That's kind of where I limit myself. I will be basically, if there's lots of people that show up, I'll pick one person and ask them to join me if I can figure out how to do that. And I can do a live tapping session with them. You can follow along. With us. So as we do the tapping, there's this sensation called, this phenomenon called borrowed benefits, where you can tap along with me and the person who I'm tapping with, and repeat the statements as I say them or how they resonate with you more. You'll know what I'm talking about in a moment with that. And you can still get the benefits. So even though I'm leading with someone else, you can still get the benefits. You just think it in your mind what you want to get out of that, or what your emotion is, or actually change what you're saying in response to what I'll be saying. Tapping is a really, really powerful tool. It uses the same meridians, that's energy centers in the body, as acupuncture and traditional Chinese medicine. And what we use instead of needles, we do acupressure, which is why it's called tapping. So we tap on different energy meridians of our body. And what that does, and we do that as we say stressful things, distressing things out loud. What that does is that changes the way that the brain processes that stress. So we're sending messages, calming messages to the amygdala and the hippocampus. Those are the stress centers of the brain. While we say these negative things and as we're feeling these negative emotions, that's what's going to change the way that we process these feelings. And so we're going to focus here on stress related to this pandemic. But sky's the limit in terms of it. But this is not going to be like personal development sessions for people. I do that privately, and I'm happy to do that with you. But this is going to be all about how we're managing our emotions and our stress related to the coronavirus. Hi, Kathy. So anyway, so I'm going to talk a little bit about some background on that. And if we have some volunteers, if someone wants to comment, someone who has joined to be my tapping guinea pig, I believe I can pull you up and share you here, but you're going to be on video with me, and this will be recorded, and I'll be posting it on YouTube. If no one's ready to do that yet, that's fine too, and I'll just do like a model tapping sequence that you can join with me. Hi, Olivier. So I will be doing that right now. So tapping, basically, you can tap on either side of your body with either hand. You want to have 5 to 7 taps on each location. The first one is the karate chop point. The The next one is the top of the head. The next one is the inner corner of the eyebrow. I could do it with this side. I could do it with the left hand on the right side. It doesn't matter. You could do both crossed or together, however you want to do it. Hi, Laura. Corner of the eye, under the eye, under the nose, chin, collarbone. So if you go to this little notch here in your chest, you go down an inch and over an inch. Thanks, Laura. I'm so excited to be doing this. We're all like stuck at home and this is what I do. So I should mention also to anyone listening, I don't practice clinical medicine anymore. I focus full time on physician wellness and stress reduction. So I am not on the front lines, and I'm doing this to give back to people in the world and just to do what I do best, which is helping people manage their stress. So you have the sternal notch here, you go down an inch and over an inch and you tap there. I like to use this part of my fist and I tap there. These sites don't have to be like exactly precise, but here I have room for a fist, so I'm going to do it. And then the last tapping meridian is right here under the arm, like where your bra strap would be. And I like to make a fist and kind of hit it with my wrist like that, like I kind of make my wrist go loose and I hit there. You could tap here, you can tap across there. I just find it a little challenging to reach across and it's like too much energy for me, so I don't do that. So I just tap here and then you go back up to the top. So Laura, I think you were gonna maybe volunteer, maybe? Let's see if I can, I don't know how to add you. This is new. I just like created this morning. So this concept came to me while I was meditating today because I'm creating a 7-day coronavirus emotional survival kit for doctors. It's going to come out as like a 7-day email. But then I just decided I'm going to do this. So I've spent the morning getting this ready and I'm just not sure how to add someone. If anyone knows how to do that, I feel a little bit lame for not knowing how to do that. Let's see here. Yeah, I don't think I know how to do that. So I'll figure out a way to do that. And if anyone else knows how to add people, I will get my SHIT together for tomorrow and have someone actually doing this live with me. I'm pretty sure you can just like bring someone on live. So Laura, maybe if you like, anyway, whatever. I'm just going to go with the flow because that's what I do. I teach people to do is when I meditate, I'm going to go with the flow. Tomorrow we'll have a live person doing it. Does someone want to text in a particular emotion that they're feeling right now? Let's see, there's another thing. You're not seeing an option for that. Okay, I'll have that sorted out for tomorrow. Does someone who's watching want to type in, comment with an emotion that you're feeling right now? And not just the emotion, but what specifically is causing that emotion. So not just anxiety, but what you are specifically feeling anxiety about. I am patiently waiting. I'll share an example of someone that I worked with last week, at the end of last week, is a doctor, and she actually mentioned she was feeling some resentment because she is she's a ER doctor, and she was like at her, no joke, she was at her friend's wedding about to walk down the aisle as a bridesmaid, and she got called by her boss. She had had a patient that she had tested for coronavirus, and it came back positive. This woman was barely sick at all, someone who came into the emergency room all the time. She came back positive, and so her boss was like, you got to get out of there. Do not walk down the aisle. Do not pass go. Do not collect 200. Please bail now. So she basically left, had to leave her friend at the altar basically, and go home and isolate herself for 2 weeks. So she was feeling extremely like resentful that, God, this is another life event that I'm missing because I am in healthcare. Okay, so Laura's having lots of anxiety in her chest. Can you tell me what the anxiety is about specifically, Laura? So I can use that to tap. Because with tapping, we really want to tune into the emotion that we're having. That's how it's going to work best. And we want to be as specific as possible. So rather than just saying I have anxiety, we want to be, I'm anxious that I'm going to get the disease and spread it to my children, or I'm anxious that I'm going to not be able to make a living for myself and, not support my kids or something like that. Okay. Okay. So Olivier, Laura's came in first, so I'll do hers first and then I'll do yours next. So Laura's saying, I'm anxious about the decisions regarding what surgeries to still do versus which to cancel. I'm also frustrated that our medical group isn't making clear plans. And Olivier says, as a health practitioner, I'm concerned about the fact that I may not make it financially due to practice closure. Amen to that, my friend. I hear you, and a lot of people are going through that. So let's do two today. I'll do first for some of the healthcare people who are on board. Let's do the frustration, because that's a little bit different from anxiety, which is kind of nice. So we'll do frustration, and then we'll do that one for Olivier. So everybody can tap along here. We're going to do what's called a setup statement first, where you tap here, and you can tap along, and you don't have to do exactly what I'm saying. So if something doesn't resonate, you don't have to repeat it, but think in your mind, or you can just go along and repeat everything, but think in your mind what you want help with. So if you're having frustration or anxiety due to something else, fill in the blanks, or just think about your own frustration and anxiety, and you'll still get benefits. It's really, really cool. All right, so we're going to start with frustration. So even though, and I'll say it as if I am you. Also, I'm going to say I, like first person, and then Laura, you there with you can do it with me. Everyone else will do it too, and just repeat after me. So even though I'm feeling frustrated that our medical group isn't making clear plans, I love and accept myself. And I'm going to pause and let you repeat that. Even though I'm frustrated that our medical group isn't making clear plans, I love and accept myself completely. Even though I'm feeling frustrated that our medical group isn't making clear plans, I love and accept myself exactly as I am in this moment. All right, and now we're going to go to the top of the head. We're going to put this karate chop point ahead away. We only do that at the beginning for that setup statement. Top of the head. I'm frustrated. I'm feeling lots of frustration right now. All this frustration. I'm frustrated that our medical group isn't making clear plans. I don't know who's in charge. Who is going to help me navigate this coronavirus crisis? I'm feeling so frustrated right now. I'm aggravated that our medical group isn't making clear plans. I'm frustrated. From day to day, I don't know what's going to happen when I get to work. I feel like I don't have one clear source of information to make my daily decisions. I'm so frustrated. I'm feeling frustrated. All this frustration. Our medical group isn't making clear plans. And I just don't know what I'm going to do from a day-to-day, on a day-to-day standpoint. Okay, so let's pause. Now, I forgot to do this, but usually when we begin a tapping sequence, we're going to measure how strong our emotion is. So this frustration, Laura, if you're able to do this, how strong was your frustration when you've done tapping before, I know. So how strong was your frustration when we first started on a scale of 0 to 10? And then you're going to check in with that severity level as you keep tapping. So hi, Eric and Ann. So let's see so we'll just kind of wait and see. That's fine. So let's say Laura started off at a 7. So now that we tapped through 3 times through, we're going to stop. We're going to check in, take a deep breath. And we're going to check in with how frustrated we're still feeling. Are we feeling the same, more, or less frustrated? And it doesn't matter if we just want to take note of it. And then we want to ask ourselves, has anything come up for us? Maybe there's a new emotion. Maybe anger has come up towards our administrators in our healthcare. So, okay, so Laura was saying it started at a 7 and now it's down to a 4. Laura, did anything else come up for you while you were tapping? Emotions, memories, insights, aha moments, or maybe a new emotion? That's something else that we want to ask ourselves, because I was tapping with someone, hey Eric, tapping with someone this week, and they were saying, I'm having all this anxiety about coronavirus, about getting sick. But then after we did one round of tapping, they were like, actually, the anxiety is about my parents, and I'm worried that they're going to get sick. So then we switched directions and went all about tapping about how they feel about their parents. So it's important that if you get a new, very strong emotion, your subconscious is trying to tell you something. This tapping is actually kind of unlocking some of those emotions that we suppress within ourselves, and it will allow you to change gears. Okay, so a little bit more of anxiety about the unknown. All right, so Laura's frustration is a little bit better. So let's go back to, Laura, do you feel like that anxiety is stronger than the frustration, or is that, is the frustration still stronger? Because that's important. If the new emotion isn't very strong, you don't have to switch gears. But if the new emotion is like, holy bejesus, this is really all about anxiety, then we are going to, then we're going to want to switch gears and do some tapping on anxiety. So let me see if her thing comes up. So what we'll just do now is we'll tap through another thing about frustration and see how it's going. So we're down to a 4, Laura says. So I'm frustrated. All this frustration. I'm frustrated that my medical group isn't making clear decisions. I'm feeling frustrated that I don't have a clear resource to help me make clinical decisions for my patients. I'm frustrated that when I try to look for news, it just makes me more anxious. I'm feeling all this frustration. So much frustration. Who are the experts right now? Who do I listen to? Who's going to be the one to make the right decisions for me and my patients? I'm frustrated because lives are at stake right now. So frustrated. I'm frustrated that maybe I'm going to be doing surgeries on people who don't need them and unnecessarily exposing all parties to coronavirus. I'm frustrated. I'm so frustrated. All this frustration. All right, Laura, get ready to tell me how strong your frustration is, and then we'll switch, and your anxiety right now. So we're going to pause, take a deep breath. And so now we're going to check in with ourselves. Did any new emotions come up? What's going on with our current emotion? So how strong is the frustration? And how strong is that anxiety that we had mentioned before? Because her comment came in after I'd asked about it, or started tapping again. So we want to check with our frustration. Any new emotions coming up? Any aha moments of clarity, realization that, like, all sorts of stuff comes up. So Laura's saying the frustration is about a 2. So awesome. Okay, so we've gotten the frustration down from an 8 to a 2. If you're still feeling frustrated right now, then keep tapping. Just repeat, I'm frustrated, I'm so frustrated, over and over and over again. Go through the points until it's down to 0, 1, or a 2. Now we're going to switch base to the anxiety is just related to the unknown, not knowing how bad this will get and how much it's going to affect her. And I think we can all relate to that. So let's switch gears. So this is what we normally do in tapping. So the anxiety, the frustration is low. It's about a 2. So now we're going to switch to anxiety. And Olivier, if you're still here, I think you are, you're having some anxiety about the fact that you may not make it financially due to practice closure. So we can wrap some of that in to this thing. So what you're going to do when you have a new emotion that comes up, you do a whole new setup statement. So even though I'm feeling anxiety, not knowing how much this pandemic is going to affect me and how bad it will get, I love and accept myself. And now you'll repeat after me. We can probably all relate to this one. Even though I'm anxious that I don't know how bad this coronavirus is going to get and how much it will affect me personally, I love and accept myself. Even though I'm having a lot of anxiety, feeling very anxious about not knowing how bad this outbreak is going to get, this pandemic is going to get, and how much it's going to affect me and my family and my livelihood, I love and accept myself exactly as I am in this moment. All right, top of the head. I'm anxious. Corner of the eye. I'm so anxious right now. Sorry, that was the corner of the eyebrow, and this is corner of the eye. All this anxiety. I'm feeling so anxious about this pandemic. I don't know how it's going to affect me. What if I'm not able to support myself and my family? There's so many unknowns, and I just don't know how to process all of it. All this anxiety. I don't know how bad it's going to get. And I'm looking towards all these sources of information, and no one can give me any real answers. I feel so anxious. I'm afraid that I'm going to get sick. I'm afraid that I don't know how it's going to affect my loved ones. All this anxiety. What if I can't pay my bills? How am I going to make a living if I'm not able to see people? All this anxiety. I'm feeling all this anxiety right now. So much anxiety. So much isn't known. How bad will this get? How much will this affect me? I just feel so powerless. All this anxiety. All right, so let's stop. We'll take a deep breath in. Now, signs for you all as you're tapping to know that it's working is if you sigh on your own. If you find yourself yawning, I feel better even just tapping on that myself because I'm having some of this anxiety too. If you find yourself yawning, sighing, tears are a sign of release. Laura and Olivier, if you both want to tell me how strong your anxiety is now, Olivier, if you want to say how strong it was before you started, how strong is the anxiety now? Check in with yourself. Maybe it's bringing up a different kind of anxiety. So if we're just tapping on anxiety about all of it, that's kind of too big of a topic. So maybe you want to focus really on the financial aspects of it. Laura's saying her anxiety maybe went from an 8 to a 5. And I want you all to know Laura has been tapping for some time. She's taken some of my courses and done some of my videos. So if you're not feeling any benefits right now, she's like really good at everything. She just always, like, everything works for her very quickly. And so don't feel bad if you're like, I still have anxiety. Your anxiety could be getting worse right now, and that's totally normal. Okay. So Olivier is now realizing that it's not all about anxiety. This is super powerful. So Olivier, can you comment a little bit more about what it is about for you? And so for Laura, the anxiety is going down. For Olivier, he's having an aha moment. He's having okay, this is about something different. And that's important to tune into that. So, and Laura's laughing right now, but she really, like, she's just like, poof, I get it. she's a general surgeon, and she's also does really amazing strength coaching for physicians. So okay, Olivia is saying it's about anger now. So that's really great. So we'll stick with the anxiety for a little bit, but if you're tapping on your own, you may want to switch to anger. Olivia, do you want to just tell us what your anger is about, just so we are familiar with what that is? I don't want to get like tapping with two different people at the same time, but you guys can see how this is all working here. And if I'm Olivier right now, I'm going to switch bases, and I'm going to be like, even though I'm angry, I love and accept myself. Even though I'm angry about whatever it is, I accept and forgive myself, or I love and accept myself. And then you go through on anger. So let's stick with the anxiety for now. Let's go back to it. So I'm anxious. I'm feeling all this anxiety right now. So much anxiety. I'm anxious about the unknown. I'm anxious because I don't know how it's going to affect me and my family. I'm anxious that I don't know what each day is going to bring. How can I take care of my patients if I'm not able to see them? All this anxiety. I'm feeling so much anxiety. I'm feeling anxiety that I don't know what is coming next. How much worse is it going to get? How many weeks and months are we going to spend in this social isolation? I'm feeling so anxious. I'm having fear. So much fear right now. There's so much fear going on in this world. All this anxiety. So much anxiety. How bad is it going to get? How is it going to affect me and my family? Who do I turn to for answers? So much anxiety. So many things are unknown. And I'm used to knowing. It's hard not knowing. All right, so we'll pause. Deep breath in and out. All right, Laura, how's it going for you? And Ollie, maybe you can post here if you started tapping on anger, or if you are tapping in on anxiety still. So Ollie was saying he's angry about not being able to help his patients the way he wants to, and that's how a lot of people are feeling. And he goes to India every work, and he can't do it at home because the clinic had to close. Yeah, so we're all just like, what am I supposed to do? I'm supposed to be helping people. So we're checking in with ourselves. We want to get the level of the emotion that we're feeling. And we want to, I'm just looking at the comments here. We want to get the level, check in with any aha moments, any changes in emotions, new emotions coming up, any memories, or anything else, even in the same emotion, other things coming up. Olivia was still doing it on anxiety. Great. Okay. And Laura's saying feeling better. Anxiety feels down to about a 3. All right. So what we're going to do now is we're going to do what's called tapping in the positive. So, Laura, can you tell me how strong your frustration is right now? That's what we were tapping on at the very beginning. That had gotten down to about a 2. So if you can tell me what your frustration is now, and I'm going to talk a little bit about tapping in the positive. So tapping in the positive is basically once you've gotten enough of that negativity out of your body. So if you are down to like a 0, 1, or a 2, maybe even a 3, like if you started at a 10 and you're down to a 3, you might be able to start tapping in some positive. But if you started at like a 6, you want it to get a little bit lower. Then you can start tapping in some positive statements, which I'm going to go through with you now, and you can do those with me. But you don't want to do them, frustration is about a 3 for both of them. Okay. You don't want to tap in positive until the negative stuff is out, because if you start tapping and you don't acknowledge the negative stuff, your body's going to just like want to get rid of it and like not listen. So if you're 10 out of 10 frustration and you start being like, I'm not frustrated, I'm excited, I feel good, like your body's gonna and your mind are gonna reject it completely. So we want to get ourselves calmed down enough that we can start. It's like a little personal motivation session, and I love doing the tapping in the positive. All right, so I have anxiety about coronavirus. And I know that I don't know how this is all going to turn out. But I do know that I can take control over some parts of my life. I can wash my hands religiously. I can follow social isolation very strictly if I'd like to. I've finally gotten to a point where it's okay for me to call in sick as a healthcare professional. And for those of you listening who are not healthcare professionals, we come to work sick all the time because we're expected to. It's horrible. And I feel like I know there are some good sources where I can get good information. Maybe I'll ask my boss if I can be on a committee to help make decisions for the hospital. Maybe I'll start doing some online resources for my patients. That way I can help in the way that I know best. And I feel this anxiety leaving my body. It feels so good to have this anxiety out of my body. I have so much I can offer the world, and I'd like to spend my energy on that. I can feel the anxiety leaving my body. I feel so much more empowered. All right, so we'll pause. Laura, get ready to tell us how you're feeling. Deep breath in. Olivier, I'd love to hear from you also. So how are you feeling? So we just tapped in some positive. Again, if you were still anxiety at a 7, tapping in the positive is not a great idea for you. But hopefully you're feeling a little bit better by now. You can always go back through if you need to. Also remember, just as a side point while I wait for them to comment, I'm touching my face all over the place when I'm tapping, but I'm doing it at home. So I'm going to wash my hands before and after, but I'm not touching anyone in between. So you don't want to be like tapping at the supermarket when you've got like germs on your hands, because that's just not something we're going to be doing anymore. So make sure you do clean off your hands before and after you touch your face. All right, Laura feels lighter. And Ollie said he had a big sigh halfway through. That's awesome. That's amazing. So Laura's feeling lighter. Ollie had a big sigh halfway. If anyone else here wants to comment on how they're feeling or any comments, by all means, this is not just for Laura and Ollie, but I was kind of working with what they had suggested. But if anyone else has any comments about this process or what they've experienced tapping at home, using the borrowing benefits phenomenon, which is really cool, I'd love to hear from you if you've been able to tap. Ollie is saying, I think there's a way for me to help my patients remotely. Awesome. So cool. Yeah, Zoom is amazing. Ollie's, I don't know exactly what work you've been doing. I think acupuncture now, but I met Ollie when I was traveling in France in the summer of, I think it was 2012. I found him in outside of Montpellier when I was like living my best sabbatical life, and he taught me Pilates. He's amazing. So I know you've been doing lots of great work since then, and I'm pretty sure I'm not even sure you're doing Pilates anymore. So now he's kind of getting inspired. Carrie's saying she's a first-time tapper. Awesome. Can't wait to hear how this goes. Okay, you're doing acupuncture. Great. I love it. I love it. I feel like I had seen that on Facebook. So Ollie's getting inspiration from this. So it's gone from like anxiety and then anger to, hey, I think there's a way for me to help my patients remotely. How cool is that? So now Olivier is going to use his skills to get it out in the world. And you know, I'm doing this for free, but I'm helping people hopefully right now, you know, depending on, hopefully this will get shared more and more, and we'll have more people joining us. And but that's okay. I have a mission. I had a reason to get dressed this morning and like put on some makeup and look nice for the camera. So it's fun to be able to do stuff and give myself some agency here. I feel like there's stuff that I'm doing. Carrie is saying that it's her first time tapping, and other emotions came up, and she stopped during the positive vibe tapping because her body was not ready for it. Great. So you aren't ready for it, and that is perfect. So you kind of stop, but you can see where it's going. So once I stop this video, it'll probably still be here in this group. I think they stay in there, and I'm going to repost it also on my YouTube account. The link is in the comments here. Is the meditating doctor. So we will that will be a resource for you to come back on. And I'll be doing this every day at noon. We'll see how it goes as an experiment. I'm hoping that it grows and grows. I need to figure out how to get someone on here with me so you can watch me tapping with them and kind of watch the magic as it happens. And I know there's a way to do that. I had like 2 hours to prepare that this morning. So also had some other calls this morning that I had to do. So thank you to all of you. I'm going to end here because I feel like this is a pretty good end point. I don't want to just ramble on just because I can. So thank you to everyone who came such last minute today without notice. I hope that it helped with your stress, and that if you're kind of moving through it, that you continue tapping on it and see how it goes. Please share this as widely as you feel called to do. And join every day that you can, especially if you're home and doing nothing. Might as well come on and get some good juju and get the borrowed benefits of tapping on your own as I'm tapping with someone else. And if you have suggestions on how I could make this even better, I'm totally open to that. This is evolving just as the world scenario is evolving as we speak. So is this little support forum for you. So anyway, thank you all for being here. I'm going to put the YouTube link. Oops. That's not it. I will put that up here again in the comments here. And I think it went through. There we go. And I will see you all tomorrow. Thank you so much for joining. If you want to be the one-on-one person, I think I probably just need to get that figured out in advance rather than doing it on the spot. If you want to be the guinea pig tomorrow, message me, let me know, and we'll get that sorted out. All right, guys, everyone stay healthy. Remember, this is not medical advice. This is a place for support. If you need more help, call your support system. If you want to work with me doing one-on-one tapping, reach out to me. I'm happy to do that as well. All right, see you all tomorrow.